I just wanted to talk a little more about the simple partial seizures I have, just describing them a little more. It's hard for me to describe them because I find it hard, and I'm pretty good at clearly saying things, explaining what I'm thinking. So, some of the other ones I would have, now I tend to have ones that are, I used to have auditory hallucinations, I still do. So, oftentimes I feel a buzzing feeling. So, I feel kind of like as if my head is vibrating. Not exactly, but if you've ever felt like your whole body kind of was vibrating all of a sudden, well, my head, it just feels more intense. So it's like suddenly I get a jolt of like, suddenly I feel this whole buzzing, vibrating feeling in my head. And like I said, I kind of feel it throughout my body, but it's mostly more intense in my head. Then oftentimes one side or both sides get completely muffled so that I can't hear, but then I hear this buzzing sound. Or sometimes it's a ringing sound. So it'll sometimes be like I can hear the ringing through this ear and this one's totally muffled. Or sometimes they're both muffled and I hear this loud buzzing sound. Sometimes you hear a shrieking noise. Sometimes I hear like they're all now they're actually not that strange, because this is not strange to me, because the other seizures are the ones that felt strange. These ones are a little bit more manageable. So these ones, I tend to have some kind of, like I said, auditory hallucination, and that's very typical of simple partial seizures and seizures in general. That auditory hallucinations, even visual and other types of hallucinations, are very common because it's in your brain and it's misfiring. So go figure, you have a misfire and you hear something that's not happening, but it is real for you. And that's the hard part, is that these seizures are an experience that is real for you. So you feel that whatever is going on really is happening. And I don't know how to explain to people how awful that is. Because when you have really upsetting, negative, confusing, depressing, just awful seizures, that's what you feel and are experiencing. Even when everybody else is just happy-go-lucky. It's not the same in your world. And like I said, the confusion is really hard because it's hard to even determine that I've had a seizure oftentimes, because I tend to doubt it. I say, oh, did I just have a seizure? And then I go, well, no. And yet, most of the time, it's yes. However, I've gotten really good recently at identifying what my seizures are. And that's why I decided to make this YouTube channel. Another type of partial seizure that I've had is a Jamais Vu, it's called. And it's actually one where I was sitting across the table from my sister, and we were talking, and I think we were having lunch sometime. And suddenly I had this crazy feeling. This is my med alarm to take my meds, but I will take them in a little bit. In case you guys don't have a med alarm and you take epilepsy meds, maybe you should make one. It's really important not to miss your meds. I haven't had a tonic-clonic seizure in 12 years, and I am so glad. And so I'm pretty diligent about taking my meds because I really don't want to ever have one again. So then the partial seizures, the Jamais Vu, with my sister, suddenly I felt like I did not know her at all. Now I knew in my brain, but I had no feeling that I could tell who she was. Like as if I didn't know her at all. It was so scary. And I just remember sitting there like just frozen, kind of going, what in the world is going on? And being so scared. And that's one of my memories. And that was, a seizure. I've read about other people having that type of seizure. And like I said, then there's the auditory hallucinations, the buzzing, the feeling that my head is vibrating. I've had visual hallucinations. One time I was lying in bed and I looked up and the fan was moving, but it was not on. And I was looking at it going, oh no, I know the fan's not on. And I had just thought I had a seizure, so it was like, okay, I guess I'm seeing the fan moving. But that can be really scary, you know? It's kind of creepy to see things that you know are not happening. There's also a lot of partial seizures that are other emotions. I don't tend to get ones that are anger or mine tend to be anxiety and fear and like the doom feeling. So it kind of depends on where it is exactly in your brain and what it's firing. So one of the things that is really hard is getting depressed, because you have this misfiring in this portion of your brain that then it increases your or causes your depression. They're, you know, the chicken and the egg, what comes first, but they definitely intertwine. When you have depression and epilepsy, they go hand in hand. So more seizures cause more depression. More depression tends to increase your stress and stuff and increase seizures and make them worse, because if you're depressed already and then you have these feelings, that's really bad. So the other thing though is that these feelings, not only do you feel depressed because of the experience you're having, but in your brain, it kind of, everybody's different, but with me for seizures, I get worn out and feel exhausted from it. When they were really big, the partial seizures, if you can call them big, they are called simple partial seizures, but they would be so intense, like I said, that I would have all these feelings and this fear and this, you know, just intense experience. And I would not lose any consciousness, and I didn't know how to tell people. So I was experiencing all of this while I was having a conversation with somebody. And that's what I want other people to know. Like, you do not need to just push through it. You can tell people that, you know, this is what's going on. And this is what I'm experiencing, because it is so horrible to go through it alone. You've got to share about it. And I really find that the only way I felt like I could share with other people was when I finally heard other people describe these seizures. I'm trying to think if I could describe some more. There's the Jamais Vu, Déjà Vu, you know, auditory hallucinations, visual hallucinations, memories. So I sometimes would have just sudden visions of memories. And some of them were memories that I didn't recall very well, so they were jolting. Because suddenly I would see something, and it was just so weird, because I'd be like in the kitchen talking to somebody, and suddenly I would just see in my mind's eye this whole memory. And oftentimes they were bad memories. So that was distressing, very distressing. And that's a hard one. Because having memories come back, especially if they're bad memories, is very distressing, and in the moment especially. But also, like I said, afterward, when your brain is kind of depressed after misfiring so much, then it can increase the depression and the effect of the depressing thoughts and symptoms on a very neurological, physiological basis, as well as a psychological basis. Other simple partial seizures that I've had, they can vary in type and intensity. Over years, they can change. Mine have changed. They've gotten a lot, what I consider, simpler and more manageable. The auditory hallucinations with the buzzing and the vibrating feeling, I can handle that. I just don't have the same awful, intense emotions going. I don't feel good. I don't feel happy. I feel frustrated, upset, sad, you know, whatever it is, I feel all of it, but it's just not as intense. And like I said, that feeling of doom was the worst thing. I think it's because literally I felt I was going to make the worst mistake of my life. And like I said, whatever you can think of that is the worst thing you could possibly do that you think, you know, it's not hurting somebody, but just like what would be the worst thing you could accidentally do. And that's what I felt all the time. And so if you're struggling with this, maybe write down what are some of the seizures you experience, and you know, make a little video of it, and you could share it with me, because I would love to hear some other people's descriptions of their seizures. And I wanted to just say this is somebody's description of a temporal lobe seizure, and she said, then I feel as if I'm here but not here, kind of like being in a dream. And it's as if I've lived through this exact moment many times before. And so that's part of the deja vu feeling. And like I said, sort of like you feel here and not here. And for me, it was also felt so real. And this person said the whole world suddenly seems more real at first. And the whole thing lasts a minute or two. Used to last longer. They last 20 seconds now, which is much better. It still takes me 2 hours to recover. So when I was having them before, I'm quite sure that I was having one after the other, and that time between them was probably not long enough to fully recover and get out of the confusion state. So, like I said, it takes me 2 hours to feel less confused and back to kind of clear thinking after a partial seizure. And I only have like 3 or 4 a month. I used to have maybe 3 tonic-clonic seizures a month. And so since those were uncontrolled, it means that and I know that the partial seizures were uncontrolled. So like I said, I could have been having many, many partial seizures a day. And like I said, without much time in between them, you can never get a clear state. And I really am concerned about people who are never getting out of the seizure state. If you don't get out of the state of being in a seizure, you cannot think clearly, and you will not necessarily be able to get the help you need. So I'm going to talk more about temporal lobe epilepsy, depression with epilepsy, suicide risk in epilepsy, and other important things. Thank you.